Study: 14 million lives could be lost due to Trump aid cuts. The Trump administration is formally shutting down the United States Agency for International Development today after canceling 83% of its programs earlier this year. The administration says the agency has misspent billions in funds and has little to show since the end of the Cold War. That argument clashes with a new study published Monday in the medical journal The Lancet. The study estimates that U.S.A.I.D. programs have saved over 90 million lives over the past 2 decades. The researchers also estimate that if the current cuts continue through 2030, 14 million people who might have otherwise lived could die. Is U.S.A.I.D. a good use of resources? We found that the average taxpayer has contributed about 18 cents per day to U.S.A.I.D., says James McKinco, a health policy researcher at UCLA and study co-author. For that small amount, we've been able to translate that into saving up to 90 million deaths around the world. Since U.S.A.I.D. was formed in 1961, it's funded a wide range of programs, from giving school lunches to children in Haiti to distributing HIV medication across sub-Saharan Africa. While many studies have analyzed narrower slices of U.S.A.I.D.'s portfolio, including maternal mortality and child health, no peer-reviewed research had attempted to take stock of the agency's overall impact. What we really tried to draw out was, how did the funding from U.S.A.I.D. influence a set of outcomes, says McKinco. We were most interested in looking at mortality to really be able to quantify the impact of these investments. The team analyzed demographic and death data from 133 different countries that received aid between 2001 and 2021. By comparing deaths across countries that received low, medium, and high amounts of U.S.A.I.D., while accounting for differences in population, income, education, and other non-aid factors, the team was able to estimate the human effects of that aid. And those effects were substantial. They found that high levels of U.S.A.I.D. funding were associated with a 15% reduction in deaths from any cause across all ages. For children under 5, the percentage more than doubled to 32%. Once you translate that 15% reduction into the number of lives, it actually represents 91 million deaths averted, says McKinco. When we saw that number, we were indeed surprised. Digging into the data further revealed that U.S.A.I.D. programs were associated with the biggest reductions in deaths from HIV/AIDS, malaria, and neglected tropical diseases such as dengue and chikungunya. Smaller but still statistically significant reductions in mortality were seen for tuberculosis, nutritional deficiencies, diarrheal diseases, maternal and paternal conditions, and lower respiratory infections. The Trump administration's abrupt and steep cuts to foreign aid have halted most of U.S.A.I.D.'s programs. To estimate how many lives could be affected by dismantling the agency going forward, the researchers used what they'd learned in the retrospective analysis to estimate how many preventable deaths might occur if the current U.S.A.I.D. cuts become permanent. If that happens, they estimate that somewhere between 8 and 19 million people could die, including 4.5 million children by the year 2030. Even if you take the most conservative estimate, these are still really significant in terms of lives lost, said McKinco. Overall, the study fills a major gap in providing a bird's-eye view of U.S.A.I.D.'s impact, says Brooke Nichols, an infectious disease modular at Boston University who wasn't involved in the study. I like their statistical approach. It was really well done and robust, she says, noting that analyzing the impact of so many programs across so many countries is challenging. Death data isn't perfect in many countries, which adds some uncertainty. While U.S.A.I.D. is often the biggest foreign aid donor, other nations and organizations also contribute. If contributions from other groups are correlated with U.S.A.I.D. funding in a particular country, it can be hard to parse the specific impact of U.S.A.I.D., she says. Still, she praises the timelessness of her study. The value of the retrospective work is helpful to show the world what can be done with concerted effort, bipartisan support, to show just how much impact you can have, she says. Putting numbers to the lives that could be lost if funding isn't restored does something very important, she says. It highlights the costs that policy decisions can have on human lives. Absolutely. So yeah, this is pretty shocking. To be completely honest with you, I wasn't even aware USAID was a thing until this administration came in and cut it. Okay, so like I'm very surprised and impressed that the USAID has saved 90 million lives over the life of its program over the past 2 decades, and that should be one of the sort of like Social Security. It should be something as Americans that we are very proud of. That this is a really good thing we've done. We're really proud of it. It's not all that expensive or difficult to do, but we've done it, and we should be proud of this. This is a good thing that we've done. And the idea that we're cutting it is just ludicrous. While we do live in the United States, and ideally, you have politicians and interests that are, America first, human beings are still human beings regardless of where they live. And if we have the capacity to only give a couple cents per person, and as the United States, the wealthiest, most powerful country in the world, has the ability to save tens of millions of people's lives across the world with very, very little cost to us, seems like a no-brainer. Seems like something we should be doing without question.